Greetings and Happy New Year to you all. We are just starting off the new year with, I wanted to put out at least a shorter video summary with information as it pertains to the rollout in the state of Oregon with vaccinations for COVID-19. Just in the past 2 weeks, I was looking around what's happening around the country and hoping that, as with other states, we would be learning how the state of Oregon is planning on making vaccines available. And I'd have to say it has been a very quick amount of information in a quick period of time. So I'm trying to keep you all up to speed. And this may be very dated by the time you get a chance to listen to it. I have a much longer, more detailed video accompanying this with a link that I'll include if you've got about a half an hour, and it was more of a summary as to guidelines. But what I wanted to do with this video, I'm trying to keep it short, is to highlight what are the more common questions I've been getting called about. And it's basically like, when am I going to get my vaccine? Quick and short, the Oregon Health Alliance has been hard at work making the really tough and challenging decisions as to who's going to get it and who's going to get it first. And as you may have already been reading, the people that are going to be getting it first are those that are in healthcare in the forward areas, the front lines, if you will, the ones that are going to be at most highest risk of getting it. So healthcare workers and those in long-term care facilities, they've already been getting it, and they've already been receiving vaccines, not only in Oregon, but across the country. We're in what's called a phase 1A right now, and there are other phases coming, but right now phase 1A has several different groups in it. The first group are those that work in hospitals, skilled nursing facilities. Group 2 would be those living and taking care of those in long-term care facilities. Those in group 3 would be specific high-risk groups, which I mentioned and go into more detail in the longer video. Group 4 would be in patients, healthcare providers that are in other outpatient settings, which, as a solo practitioner in the community, that would be, for example, an office such as mine, working with patients directly. So, quick and short, that is the what is considered your beginnings of the Oregon Health Alliance's plan on getting the vaccine out. Second is, we got a much more longer PDF version of this that I'll include in my blog. But the bottom line is that these vaccines that are coming out, two of which are the most common that you're going to be reading about, is the Moderna and the Pfizer vaccines. Just as of this morning, got a hold of the fact sheet from the American Academy of Family Physicians, which you can read through at your leisure. But some of the key points I thought were important to at least make mention is that no vaccine is perfect. There's always going to be risks and benefits. We talk about this all the time with anything in medicine and healthcare. But some misinformation going around, like with other vaccines. No, it cannot cause COVID-19. It cannot produce an actual outright infection because it uses a different technique of creating an immune response. 2 is that it doesn't change somebody's DNA. It can't. There's no way possible. That's also in the longer video that I put together on YouTube. These vaccines are designed to reduce the severity and the duration of COVID-19 if somebody were unfortunate enough to get infected. But what we still don't know is if these vaccines can actually reduce the transmissions. So with that said, that means we're all going to be wearing masks, maintaining this appropriate and still timely social distancing measures that have been in place, and washing hands and all the things we've been doing up to this point. which is probably going to last for quite a while until we get everybody vaccinated. So quick and dirty, just to give you a heads up about the ABCs about vaccines as it pertains to COVID-19. If you have more time, I've got about a half an hour of a discussion that you can watch as well. And on my website, I will be putting in to a blog form, which should be just under this video pretty soon, basic pointers about what these vaccines can do for you. So anyway, until next time, be safe. We got to keep wearing the masks for the time being, folks. Sorry. I hope you all have had a beginning of 2021 go smoothly so far for all of you. Alrighty, we'll be in touch. Take care. Bye.